Hello, I am Dr. Nagaraj Puttaswamy. Obesity is one common thing which all the young people are worried about. Being a little healthier, see, if you are supposed to weigh 70 kgs and if you are weighing 80 kgs, I don't think there is much to worry about. But what is morbid obesity is the big question. What is BMI? How it is recorded? And how do you define morbid obesity is the big thing. Say, a thumb rule or a simple activity, if an individual is weighing 40 kgs beyond his normal desired weight. Say for example, I am supposed to weigh 70, I am weighing 110 kgs. Then I am called morbidly obese. Or if my BMI is above 40, I am defined as definitely a morbidly obese individual. What is BMI? Body mass index is formulation where we record the weight in kgs, divide it by my surface area or height by meter square. So if that is done and if my BMI is beyond 40, then I am defined to be a morbidly obese individual. What is the problem if I am morbidly individual? So we call that, obesity is one of the biggest attractor of all the medical conditions in our body system. I can become a diabetic, I can become an hypertensive, I'll have dyslipidemia, that is high in cholesterol, what commonly we call about. I will have sleep disorders, I will have breathing difficulties, I will have difficulties to move around, I will have breathlessness if I climb stairs or walk against the tide. I will have to develop arthritis very quickly. My bones will start tethering more faster, osteoporosis can set in quicker. All these possible problems can happen in an obese individual. How do we manage obesity? If an individual is fit enough and is prepared, definitely dietary activity will be the first thing which can happen. See, if you have to create a six packs is not created in the gym, it is created in the kitchen. That is what my statement is. So you have to manage your dietary activity, be less on calories, high on fibers. So if that was one important thing which can be applied into an individual activity, and start slowly onto your physical activity. Start with walking, don't start running straight away because you are significantly heavy. Your bones and your muscles are not prepared to allow you to run faster and longer. See, probably you may hurt your joints and probably that will allow you not to walk also. So maybe you can start with simple exercise, maybe even sitting exercise can be started. Maybe simple yoga stretching activities can be started along with dietary activity, and it should be a relentless activity, long-term, slow process, of course, without any doubt. Occasional cheating can also happen, there is no restriction on that, but it should not be a habitual activity or regular cheating activity, daily cheating activity, definitely it is not considered right. But if a patient would have tried all this, should there be any medical advice? Yes, there are some medical advices. Tablets in different forms can be advised to lower the appetite, to allow speedy breakdown of fat cells and also speedy breakdown of glucose, so that the fat reserve will come in and then the patient will slowly lose weight. Of course, alongside with dietary and physical activity. All this I have tried, doctor. I have tried yoga, I have tried physical activities, I went to the gym, I followed my instructor, I tried to be very strict on my diet. I am not still losing weight is one of the biggest questions when the patient comes in. So we try to investigate those sort of patients for thyroid-related disorders or autoimmune disorders, or some conditions called where the steroidal content in the body system is very high. If we try and figure out if there is some medical conditions where the patient has, and it has to be treated, and if the medical condition is also parallelly treated, patients still lose weight. But all these have been sidelined and they are told that everything is fine except that the patient is not losing weight, the patient is morbidly obese, not able to perform normal activity. Maybe a young female is there, morbidly obese, unable to conceive normally. Infertility is one of the common conditions. Normal young man is there, he is also not able to become a father because of his physical shape where he is not able to sexually perform fine. So these are common things which young individual can come up. A little elder patient, maybe around the age of 40, 45, 50, patient may have uncontrolled diabetes. Maybe they have sleep disorder, sleep apnea we call. They are dependent on BiPAP machines. Patients have severe arthritis. Those are the patients where they may be subjected for bariatric surgeries or obesity surgeries. What are the common obesity surgeries? What we can suggest? One easy to perform and easy to follow is sleeve gastrectomy, where a portion of the stomach is resected out with the help of staplers, of course, and can be done laparoscopically and relatively safe and a very quick surgical procedure. A morbid obesity patient is a very high risk patient. Inducing anesthesia, operating in that individual is a big challenge for the operating surgeon and the operating team. So we try to train the patient to undergo surgical procedure, maybe suggest him some physical activity before starting, train his lung capacity, improve his general health, and also maybe do some restrictive dietary activity before he is subjected for a surgical procedure. Simple sleeve gastrectomy will restrict the intake of food and also restrict the sensation craving for food. That is the first thing, and also it will enhance the destruction of fat cells. It will allow quick weight loss within a period of 1 month, maybe 10 to 15 kgs of weight loss is expected. By the end of third month, close to 70 to 75% of the desired excess weight loss is achieved. Say in case I was trying to tell that if the individual is weighing 40 to 50 kgs beyond the normal weight, out of that 50 kgs, 70% can be lost in a period of to 3 months. And I mean to tell, close to 30-35 kgs of extra body weight will be lost in 3 months' time. So that is a wonderful gift for a morbidly obese individual. So the patient can go back to his earlier period of life and perform normal activities. What other common surgical procedures can be performed in similar line is, one more is single anastomosis gastric bypass or a Roux-en-Y gastric bypass. In sleeve gastrectomy, it is relatively physiological because the food enters the stomach is small, but it will travel through the small intestine full length, and most of the times absorption will not be restricted. But with bypass, there is some amount of absorption also which is restricted. The advantage of sleeve gastrectomy is relatively simple to perform, quick recovery with very minimal disadvantages, where compared to a bypass procedure where there are significant amount of malabsorption which will induce, but fortunately long-term weight loss will be sustained. Sleeve gastrectomy individual may get their weight back in a period of 5 to 10 years time, but with a patient who has undergone a bypass surgical procedure will not get the weight back even after 10-15 years. So it will be a long-term effect. What other advantages are there? Say a patient who was diabetic will be out of diabetic equation. In the sense, patient was taking multiple doses of insulin, multiple tablets he was consuming, he would definitely become non-diabetic, or maybe he will restrict himself with a simple tablet. That is a huge advantage because diabetic related complications are huge. And same way, the hypertensive will definitely get his BP under control, respiratory disorder will wean off, and same way the arthritis will go away, skeletal system becomes more stronger, muscles become stronger, he can become more physically active and perfect, he can go up and down the stairs without much discomfort, which he was not able to perform before the surgical procedure. This is a huge advantage. Lifestyle changes will be there, and at the same time I personally feel obesity surgery for select individuals and people who really deserve obesity surgical procedure, it is a humongous blessing in disguise. So it will change their life and also give a new leash of life, and they can transform their career and probably go longer, and they can have a quality of life in the later part of their lives. I mean to tell that if a patient is operated at the 50-55 years who was morbidly obese, the next 10 years would have been miserable with carrying so much of weight. But then another 10-20 years of his lifespan will be very, very of high quality. That is what I can suggest. So bariatric surgery has made huge advantage for patients who really deserve.